most common breastfeeding problems women are facing nowadays?
They don't know what to do, how to feed the baby. Proper catching of the nipple and the areola is important. Many emotional problems that they might feel guilt that they're not able to feed the baby properly. The nipple and the areola should be inside the mouth of the baby.
Okay.
And the baby's lips should be turning outwards.
A new mother, how she'll identify that whether baby is taking properly milk or not?
Second thing is the baby wetting diapers. See, hormones, we have two types, like hormones which are able to produce the milk, hormones which are responsible for secretion of the milk outside of the breast. This oxytocin is responsible for the secretion of the milk. To check their thyroid levels even before she conceived, they might become hypothyroid during pregnancy.
Milk is secreted but it's not coming out.
Then she might land up in blocked ducts. So how should you deal with those engorged, painful breasts if the baby is not feeding? So the woman should first try to empty the breast, either by pumping the milk or by expressing the milk from the breast.
In poor latching, what's your advice?
While drinking milk, usually babies will not produce any sounds. So clicking sounds come when a baby catches the nipple and tries to suck the nipple.
Namaste, welcome you all to our new episode of Health Heroes of India. Today we are going to discuss a very important topic called breastfeed. To learn more about breastfeed, we have invited our guest, Dr. Shalini Duvada. Dr. Shalini Duvada is a general surgeon and has an experience of 12 years in this field, and she has treated many patients in his career.
Welcome ma'am, welcome to our podcast Health Heroes of India. Today as a topic, as you know, we are going to discuss about breast problems in women. So for that regarding, we'll have a more discussion later on. So welcome to our podcast.
Thank you for inviting me to this podcast. I'm looking forward to it. Yeah.
Ma'am, though you have long years of experience in the field of general surgery, so the topic itself is breastfeeding and in the women. So let's talk one by one question. What are the questions are there? Let's go one by one. Ma'am, what are some most common breastfeeding problems women are facing nowadays?
So first thing is the learning curve. So women at first, they don't know what to do, how to feed the baby.
Okay.
So the learning curve itself is the major problem, major issue in feeding women nowadays.
Okay.
So proper latching, proper catching of the nipple and the areola is important. So mothers should be educated regarding this. What should be the position of the baby? How should the catching and latching occur? So these are the main issues the women are facing. First thing.
Okay.
And then later on, many issues like unable to feed the baby properly, or many emotional problems that they might feel guilt that they're not able to feed the baby properly, or they're not providing whatever the baby requires. So there are many, like both emotional, physical, and many other problems. Yeah.
Okay. Why do women struggle while feeding the baby? Why they struggle?
Like we already discussed, it's the learning curve.
Okay.
They're unable to hold the baby properly, first thing, the position. And the second thing, they should know that the baby's mouth should properly catch the nipple. And latching, what we say is the nipple and the areola should be inside the mouth of the baby.
Okay.
So this is called the proper latch of the baby. And the baby's lips should be turning outwards, fanning outwards.
Okay.
This is the exact position which is required for proper breastfeeding in women.
Okay.
What happens if this is not done? They might feel engorgement of the breast because milk is not coming out of the breast because of the poor latch by the baby. So milk will be accumulating in the breast. It will cause engorgement and pain. Due to that pain, and the woman may not be able to feed the baby properly later on.
I think this generation, like right now, the newborn and new baby born, and the first time the baby born and the woman doesn't know how to feed him. So it's a kind of educational thing where she should be educated regarding.
Definitely, education is important.
His family, his parents, his husband, or she herself should be educated on particular topic of like breastfeeding, how breastfeeding should be done.
Yeah, there are actually a proper professionals, like there are a group of professionals called lactation consultants.
Okay.
They are there to educate the woman and their family like to women, like how should they cope up with this breastfeeding,
Okay.
and how should they position the baby, and what should they do, what are the signs they should look for if there is any problem with the breastfeeding,
Okay.
and the parents or relatives or the husband or the spouse educate them to provide adequate emotional and physical support
Yes.
to the women during this time.
After a baby got birth, so a new mother, how she will identify that whether baby is taking properly milk or not?
Yeah,
Adequate
most
meal
important
is-
question.
Yes.
Yeah, people come with these questions to the
Yes.
gynecologist or to the pediatricians. How would I know? Like, how would I know if the baby is getting enough milk from me?
Yes.
So this is important. First thing is the baby feels content after taking the milk. The contentment, like the baby is happy after feeding.
Okay.
Second thing is the baby wetting diapers.
Mhm.
So if the baby wets about 6 to 8 diapers, like if the baby passes 6 to 8 times of urine per day, then it is sufficient that the baby is getting adequate hydration, adequate milk
Okay.
from the mother.
Mhm.
And the third thing is that consistent weight gain, like from birth to at least 1 year. We usually advise breastfeeding for about 1 year. So consistent weight gain from birth to about 1 year in itself indicates that the baby is getting enough breast milk. Yeah.
What role do hormone plays a role in breastfeeding, and how they disturb if there will be any hormonal imbalance?
Yeah.
Does it disturb breastfeeding?
Oh yeah, see hormones, we have two types, like hormones which are able to produce the milk, hormones which are responsible for secretion of the milk outside
Okay.
of the breast.
Okay.
So any disturbance in the hormones that produces the milk or that might cause any imbalance in production of the milk,
Okay.
like thyroid hormones, like prolactin, these hormones. Prolactin is the hormone which is responsible for production of the milk.
Okay.
And then if the patient or if the mother is having some PCOS issues or some thyroid issues, there might be some delay in production of the breast milk,
Okay.
as well as she might not be able to produce enough breast milk.
Okay.
Whereas oxytocin is a hormone which is responsible for secretion, that is pumping of the milk outside of the ducts into the nipple, so that when the baby sucks, this oxytocin is responsible for that secretion of the milk. So if there is any imbalance of the oxytocin hormone, although adequate amount of milk is being produced, it is not being supplied to the baby because of the lack of hormone. So definitely hormones play a major role in production as well as secretion of the milk.
How do you counsel the patients or a new mother about the hormonal imbalance? Is there any specific thing that you have to educate the new mother about the hormonal imbalance?
Yeah, definitely thyroid, like hypothyroid patients.
Okay.
So they will be having issues in breast milk production. So we'll be asking the woman to check their thyroid levels even before she conceives.
Okay.
And later on also, during pregnancy and later on also, the hormones are being disturbed, thyroid hormones.
Mm-hmm.
Many women who are not hypothyroid before pregnancy, they might become hypothyroid during pregnancy.
Okay.
So they might land up in breastfeeding problems later on after delivery. So definitely thyroid hormones are the most important hormones that might cause imbalance in breast milk production and secretion, as well as people with diabetes and any other PCOS issues.
Mm-hmm.
They might have issues with the breast milk production. So we educate the women that if you are having these issues, that make sure that they were balanced during your pregnancy and lactation.
Okay.
Yeah.
So coming to the physical challenges, what basically a new mother face. So could you elaborate about what kind of physical challenges basically if milk is secreted but it's not coming out,
Yeah.
or if milk is not secreted, then what kind of physical problems a woman will face?
Yeah, when milk is being produced, but the baby is not able to feed properly, or the milk is not coming out of the ducts through the nipple properly, then she might land up in blocked ducts.
Blocked ducts.
Yes.
Okay.
The ducts, what we call them as the lactiferous ducts. They are called the milk ducts in normal terminology. Yeah, if there is any stasis that milk is not coming out of the ducts, then these ducts get blocked.
Okay.
So what happens to the rest of the milk? It gets stasis. What we call stasis is nothing but it's just left over in the breast. It's not coming out of it.
Okay.
So the woman feels engorgement of the breast. She feels sharp pain in the breast.
Okay.
She might also like land up in infection of the stasis of the milk. Like there is always milk that is being like left over in the breast, and moreover there is infection into that leftover milk. So this is called mastitis in medical terminology.
Mastitis.
Yeah, infection of the breast tissue.
Please elaborate them. What is mastitis?
Yeah, mastitis is nothing but inflammation and infection of the breast tissue.
Okay.
So most commonly, it is not rare in lactation. It can occur in normal women as well, not just in lactating women.
Okay.
But more common in lactating women due to this issue. Like milk is getting blocked and it is not coming out properly. Milk ducts are getting blocked and the milk is not coming out. So the stasis of the milk will invite infection.
Okay.
So infection will lead to mastitis. If we don't intervene at this stage medically, then this might progress to an abscess.
Okay.
Abscess is nothing but pus formation inside the breast.
Okay. So the women who do not have baby, unmarried women, on that woman also this problem occurs, mastitis?
Yes, it occurs in both married, unmarried, lactating, non-lactating. In any woman, it is common.
Okay.
Yeah, but
So
more so
how
in
they-
lactating women due to this issue.
Okay. Then how they will find out that whether they are suffering with mastitis or not? Is there any kind
Yeah,
of...
they should look for some symptoms and signs.
Yes.
First thing is that they'll have pain. Second thing is that breast feels warm or hot to touch.
Okay.
And third thing is that she might have fever.
Fever also.
Yeah.
Yes.
These are all the signs they should look for, symptoms and signs.
Any kind of different localized pain near breast?
Yeah. See, if this pain, usually it is not localized initially.
Okay.
Later on, it is localized to one place.
Okay.
Yeah. Initially, it is like diffuse pain.
Diffuse
She'll
pain.
just have diffuse engorgement of the breast and then she'll have pain.
Okay.
She might later on have fever.
Fever.
Yeah.
Due
When
to this
infection
phenomenon.
comes, then she'll have fever.
Ma'am, as you told, after getting mastitis, breast getting engorgement.
Yeah.
A newly mother, how he will address all these issues?
Yeah. New mother should first check for the position of the baby.
Okay.
If the baby is catching and latching the nipple properly, usually there will not be any problem in engorgement of the breast. But still, if the baby starts sleeping at night without drinking milk, at the time when she gets up in the morning, she might feel a bit of engorgement in the breast.
Okay.
So it should not be left alone.
Okay.
That engorgement, she should deal with it. So how should you deal with those engorged, painful breasts? If
Yes.
the baby is not feeding. Usually it occurs if the baby is not feeding.
Okay.
So how should we deal with this?
Mhm.
So the woman should first try to empty the breast.
Okay.
Either by pumping the milk or
Yes.
by expressing the milk from the breast.
Okay.
And second thing, she might do some warm compression.
Warm compression.
Warm compression over
Okay.
the breast. Or she might take a hot water bath.
Okay.
Yeah. So warm compressions, hot water baths. And if it is so painful, she can even use basic paracetamol for pain relief.
But better to consult with the doctor.
Definitely, if these symptoms are not relieving with these basic measures, she should definitely consult
Consult the
a
doctor.
specialist.
Who is the basic to whom he or she should consult? That parents should consult.
Yeah, see, if they are having any breastfeeding issues or any breast problems, they should usually consult a general surgeon.
General surgeon.
Yeah.
Okay.
But if there are any lactation problems, like she's not able to feed properly or the baby is not catching properly, then they should better consult a lactation consultants.
And is there any role of gynecologist here?
Gynecologists definitely have a role because they are the first doctors who advise women how to feed the baby
Okay.
and how to, like, when should you start feeding. Immediately after delivery, a woman should start feeding, even if it is a cesarean section,
Okay.
within 1 hour after delivery. That is the
Within
best.
1 hour after delivery?
Yeah, within
Okay.
1 hour after delivery, women should start feeding their children.
Okay.
Yeah. So gynecologists are the best consultants for this purpose. They should advise the woman to start breastfeeding immediately.
Okay.
Yeah.
Sometimes baby don't take proper milk due to some problems or something. So in poor latching, what's your advice? How it can be corrected?
Yeah. So mother is the first one to identify whether the baby is latching properly or not.
Mhm.
So whether she should first look at the baby's mouth.
Yes.
If it is covering the entire areola and the nipple and the areola.
Yes.
It should be inside the mouth of the baby. First thing that she should look for.
Okay.
Second thing, she should listen for any sounds. While drinking milk, usually babies will not produce any sounds. But if there are any clicking sounds, coming while the baby is feeding, continuously clicking sounds are coming, that means the baby is only catching the nipple but not the entire areola. So clicking sounds come when a baby catches the nipple and tries to suck the nipple.
Okay.
So those clicking sounds, she should look for those. Why? She should avoid those. Why? This will cause cracks in the nipple. If the baby just holds the nipple and tries to suck only the nipple, not the nipple and areola, it will cause cracks in the nipple. So this will lead to severe pain in the mother. Later on, this might also lead to infection. That is what we have discussed, the mastitis in the breast.
Yes.
So that will discourage the woman to feed the baby later on. She might feel pain while feeding. So she thinks, okay, let us stop feeding because I'm not able to do this as this is causing severe pain.
I think this podcast will help newly mother so well because this kind of, as per my knowledge and what I've seen, lot of newly mother facing these issues.
Yeah, they don't know whom to consult. They don't know whom to ask.
Whom
They
to
feel
ask.
guilt by
And
themselves.
they go to the market, bringing the pump, something like that.
Yeah.
And this is very later stage they're going to and buying the pump and doing all this thing. But due to improper education or unawareness only, they're suffering. After suffering few days, few months only, they start going to meeting the doctors or asking someone to help. So many things. But initially they face problems.
Definitely. Everyone goes through that stage.
Yes.
Yeah.
Yes. Sometimes we see baby tongue tie or lip tie creates problem
Yeah.
while latching. So how we'll tackle this situation?
Yeah, tongue tie is nothing but there is some strand of tissue that is holding the tongue to the floor of the mouth.
Okay.
That's why the child or the baby is not able to lift his tongue properly.
Okay.
So, tongue is essential. See, palate and tongue should be in normal state to produce, to help the baby to suck the milk. So, if that tongue is not moving properly, or some babies are born with cleft palate and cleft lip, they'll have difficulty in sucking because lips are essential, palate is essential, and tongue is essential. So, proper position or proper health of the lips, tongue, and palate are essential for adequate sucking from the baby.
Okay.
So if there is any problem like tongue tie or cleft palate, cleft lip, there will definitely be sucking problems in the baby. So in such cases, we usually discourage mothers to breastfeed the baby. We usually ask them to express their milk and then feed the baby with the help of lactation consultants.
Ma'am, I have a question. Is nipple confusion real? And how can mothers avoid it when using the bottle or pacifiers?
Yeah, nipple confusion is absolutely real. So if you start the baby with a bottle only directly, and if you try to baby to shift the feeding from bottle to your breast milk, then the baby confuses between both the nipples, the bottle nipple and the woman nipple.
Yes.
So nipple confusion is real actually.
Real.
So what should you do for that? You should first start with the feeding with the
Breastfeeding.
Yeah, breastfeeding first.
Okay.
And then later on, if the breastfeeding is not adequate, if you think the breastfeeding is not adequate or you're unable to breastfeed the baby, you can shift to the bottle later on.
Okay.
But if you do first bottle feeding and then try to shift to the mother feeding, it will be difficult for the baby to, or if you use soothers.
Soothers.
Yeah, soothers.
Okay.
The baby cries, they put soothers.
Yes.
So if you use too much of soothers early in the life, like before 6 weeks or even before 1 month, then the baby again have confusion between that nipple and the mother's nipple.
Yes.
So it's better to avoid soothers and better to start with breastfeeding first, and then if it is not adequate, you might shift to bottle feeding later on. At least for the first 4 weeks or 6 weeks.
4 to 6 weeks.
Yeah.
Breastfeeding is mandatory.
Yeah.
Something
Breastfeeding is mandatory for at least 6 months.
6 months.
Yeah.
Okay.
But depends on the woman again. It's not pressurizing the woman. It is her call. If she likes breastfeeding the baby, she can do it as long as she wishes.
Okay. Basically, it observed, ma'am, while breastfeeding, baby usually sleep initially within 2-3 minutes. She sleeps. On that condition, what is your advice?
Yeah, this happens with every baby. Babies usually sleeps while breastfeeding, but you can just change the positions. If you think baby is sleeping and if baby sleeps, she'll not be taking adequate breast milk.
Yes.
So it is better to wake up the baby while breastfeeding the baby. So change the position. Try to feed the baby in upright position.
Upright.
Yeah. Or tickling the baby. Many mothers do this. They tickle the baby's feet or cheeks. and turn from one breast to the other breast. Stop feeding from this breast. As soon as you think the baby is falling asleep, you shift the baby. Stop feeding on this side and shift to the other side.
Okay.
Yeah.
Many times you say the breastfeeding, while breastfeeding, if mother feels any kind of struggle, does it impact mother's mental health?
Yeah, definitely. Postpartum, pregnancy, postpartum and lactation definitely impacts a woman's physical, mental and emotional well-being.
Yes.
So she, especially during lactation,
Yes.
she usually feels a emotional feeling of guilt, failure, unable to cope up with the child. She thinks that she's not enough for the child. So these are all common for every woman. I just wanted to say that through this podcast to all the women. So I just wanted to say that you are not alone. Yes. Every woman during this period feels the same way. They feel the guilt. But just you see that you are doing good. Like you should know that you're doing good. You're trying. So you are doing good. And it's not that if you're not able to breastfeed, nothing is going to happen. If you are able to breastfeed, it's very good, well and good. If not, it's fine. Let's not pressurize this issue of breastfeeding on the woman. It's her call. Many are able to breastfeed, but they don't want to do breastfeeding. Okay. Although breastfeeding is the best thing a woman can do to their children. Yes. But if a woman feels like she doesn't want to breastfeed women, it's up to her. You should not pressurize her. It's her call.
What kind of emotional support that newly mother expect from his family or his husband?
Yeah, this is the most important thing. So the new mother expects her spouse, her parents or her in-laws or relatives, whoever may be, to support her both physically, emotionally and mentally. Okay. So she expects her that she wants some rest. So she expects someone to hold the baby for her while she falls asleep or while she takes rest. She expects someone to do her daily household chores. Overall, she expects some good words, some supporting words from her husband, her family, in-laws, parents, whoever may be. So this should be the people around her should make her feel like she is good, she is doing good. And she should be given some emotional support from their family.
And we are here to take care of you and your child.
Yeah. That is most essential thing in any woman's life.
Yes, because after getting delivered a baby, so the woman itself, she needs care and affection and love.
Yes, she's already in physical trauma.
Yes.
Now she's having emotional and mental trauma due to exhaustion, due to the baby. She'll not be having enough sleep, so she's exhausted. And her baby is along with her. She should feed the baby. She should look after the baby. So she naturally expects this kind of care from her,
like
the human beings around her.
Many women, they gone through depression also on this kind.
Yeah,
this
it's
kind
natural
of
postpartum depression and all. Yeah.
Ma'am, what are your advice on breastfeeding, guilt, and social pressure?
Yeah, see, everyone goes through this stage. Every woman. I wanted to say that she's not alone. You are not alone. I'm not alone. Everyone who has delivered, who has lactated the babies, will have to go through this stage. Okay. So I just wanted to say the women who are listening to this podcast that they are not alone. Everyone will go through this stage. So I just wanted to let them know that they should share their experiences or they should take help from lactation consultants, from the surgeons or the gynecologists, or even their friends, family. They should ask for help. They shouldn't hesitate to ask for help.
Yes.
Yeah, and they can express their feelings. To some extent, these will help. And they should first know that they are not alone.
Yes.
Everyone has gone through this stage, so I will come out of this stage as well. It's like a passing cloud. Yes. And they should enjoy this phase of breastfeeding.
How do medication, diet, and certain health conditions affect breastfeeding?
So medications, as far as they're concerned, while the medications which are being used during pregnancy and lactation are such that they doesn't affect lactation in an adverse way, but there are some medications to affect in a good way, like they can improve lactation, but to some extent they should be taken only under guidance of an expert consultant. Yeah, and then taking alcohol, smoking, and all will definitely affect lactation. Yeah.
So
And in some cases, like you should observe the foods which you might take may affect the baby. Not all foods, like there are some myths that if you take leafy vegetables, the baby might have diarrhea. If you take mango, the baby might have something like that. But it's not like that. But you should look for lactose intolerance in a baby always. Like if you take too much of milk, if you are feeding the baby with milk, you should always look for signs and symptoms of lactose intolerance in the baby.
ma'am, once a baby is delivered by C-section, baby is delivered. So what kind of necessary steps a woman should take
Yeah.
while breastfeeding?
So it's a myth that the baby should not be breastfed after C-section. Oh, the mother went C-section. We should wait till she is mobile, and then only we should allow the baby to be with her. So this is a myth. As soon as the baby is delivered and the mother is out of the operation theatre and into the ward, so within 1 hour after C-section, we can start breastfeeding the baby.
Okay.
So as soon as the delivery is done, even with a C-section, we should start breastfeeding the baby. First thing is to establish skin-to-skin contact with the baby.
Okay.
So as soon as
This
the
is
baby is
within
delivered,
how many hours, or immediately after baby
she
delivery?
can feed the baby immediately after delivery within 1 hour. 1 hour is that 1 hour is for shifting the patient from the operation theatre to the ward and letting her settle down.
Okay.
And then first thing is to establish a skin-to-skin contact.
Okay.
Like put the baby on her skin. So this will stimulate, as we already discussed, the prolactin and oxytocin hormones.
Yes.
So the skin-to-skin contact and the suckling of the baby, this is called suckling reflex. So this suckling and this skin-to-skin contact stimulates that oxytocin hormones in the woman.
Yes.
So immediately she starts producing the milk, and the first milk is the best milk. That is called the colostrum,
Okay.
and it has all the immunologic agents that are required for the immunity in the baby.
Okay.
So as soon as the baby is delivered, it is always advised, whether it is C-section or normal delivery, it is advised to feed the baby immediately.
Good. Madam, it has been seen that many times in between is the breastfeeding. Women stop the breastfeeding to the child.
Okay.
So, do you recommend, or what is your advice, whether they should stop breastfeeding, whether they have some pains or something, they should stop the breastfeeding, or the breastfeeding should be continued?
Yeah, whatever happens, breastfeeding should be continued unless until the baby is not alert. If the baby is not alert, if there is a problem with the baby,
Okay.
then you might need to have, you might want to stop the breastfeeding, because the baby is not in an alert condition. The baby will not be able to take the feeding properly.
Okay.
But if, as far as mother is concerned, even if you have a breast infection, or if you have a fever, if you have vomitings or loose motions, or any problem with the mother is no way concerned with the baby, she can happily breastfeed the baby. WHO says that. Even if the mother is undergoing breast surgery, like for abscess, people usually come with abscess to us. People usually come with infection. They ask me whether, I'm having infection. If now I feed the baby, that infection might go to the baby also.
Yes.
I advise the same thing to them. Whatever happens, you can just continue with the breastfeeding to the baby. It will not cause any infection to the baby, as far as your breast is clean and well maintained.
Okay.
Yeah. If there is a problem with the baby, if it is not alert or it is not able to feed properly, then definitely you should consult a lactation consultant, whether I should stop the feeding or I can continue.
Okay. Do you think any herbal supplement or any kind of Ayurvedic medicines or any kind of things that will help to produce more milk?
Actually, there are no studies supporting herbal medications or any diets that could increase breast milk supply. As far as I know, water is the best thing that could increase breast milk supply.
Okay.
But there are many studies suggesting fenugreek seeds, moringa leaves might as well increase the breast milk supply. Okay. But there is nothing like, this diet is good, so that if you eat these more, then your breast milk will be increased. As far as you have taken adequate hydration, like water and more liquids, breast milk supply will be maintained adequately.
Okay. Many times baby don't take direct milk from the breast. So on that condition, direct pumping or using pump is the alternative way that you advise?
Yeah, definitely. Absolutely. Okay. The pumps are a blessing to recent mothers now. Yeah, if they're not able to, the baby is not able to latch properly, as we already discussed, Then they could be like, to prevent engorgement of the breast, they could pump out all the breast milk from their breast. They can even store the breast milk.
Okay.
Yeah, they can store the breast milk and they can feed the babies. So it's a blessing to working mothers as well. They can just pump it and they can feed the milk and they can leave for work.
Okay.
Yeah.
So after pumping, how many times or how many hours they can store the milk?
Usually till 3 hours, they can store the milk at 4 degrees centigrade and they can warm it up and feed the baby.
Okay.
Yeah.
4 degrees centigrade up to 3 hours.
Yeah, 3
right?
to 4 hours is
3
fine.
to 4 hours
Yeah.
is fine. Then they'll warm it up and
Warm it up, and naturally because it's 4 degrees centigrade, so
Yes.
they have to warm it up.
warm it up in the gas that
No, usually how
or
they do
keep it in
is,
the normal
yeah,
bottle.
they'll feed this baby in BPA free bottles.
Mhm.
They'll pump the milk with the help of manual or electric or battery operated pumps, and then they feed the baby with this milk. Usually after warming it up in hot water, like they put this milk
Okay,
bottle in
okay.
a hot water,
Hot water.
in a hot water vessel or something like that,
Okay.
and they warm it up and usually feed the baby.
Yes.
And it helps the woman as well. It prevents this engorgement, this block. That's yeah.
If it will take 100 women, how many patients are suffering with mastitis? If it will
Oh no,
take it-
yeah, mastitis is a common problem. People suffering with mastitis, it can occur in many ways, It can be due to regular normal infection, or it can be due to many other infections. Especially in India, it could be due to TB.
TB.
Yeah, it could be due to many other reasons.
Okay.
Mastitis. It's not that only lactating women will suffer with mastitis. It is more common in them, but it is common in other women as well.
Ma'am, what is your final advice to the mothers who are suffering on breastfeeding and how they should continue?
Yeah, breastfeeding is definitely a period of struggle for a new mother.
Hmm.
So, as I already said, they should know that they are not alone
Okay.
and they should take help whenever needed. So, there are lactation consultants now. There are professionals. They can deal with the latching and catching problems. They can deal with the mastitis problems as well. They know whom to refer at what time. So, mother need not feel that, oh, this is a period of struggle, so I'm
Okay.
not able to do it. She is going to do better. Like,
You should not feel like
with time. Yeah, it is a learning curve.
Yes.
So with time, she will feel better. She will do good. Yeah.
Thank
It's
you, ma'am.
more with the bonding. She deserves to be a good mother and she deserves a good bonding with her baby.
Yeah.
So she should not pressurize herself with this issue of breastfeeding.
Yes. Thank you, madam. It's a nice discussion, and we have come to so many things regarding breastfeeding and what the pregnant women are facing.
Yeah.
And things are developed.
Thank you for inviting me. I'm happy that I could reach out to more women and educate them regarding breastfeeding issues through your podcast.
Thank you.
Thank you.